Locking healthy people down is not a sustainable answer to try to stem the tide of a virus and only creates hardship for healthy people.
Hamilton area Conservative MP David Sweet is joining independent provincial lawmaker Roman Baber, calling for a permanent end to lockdowns in Ontario.
Psychological damage is huge during these lockdowns.
Sweet is also pointing to the widespread economic damage, saying instead of lockdowns, the province should focus on protecting the most vulnerable populations. The pair saying the entire province should move to the least restrictive level of the COVID response framework.
There is no underestimating the psychological benefit this will make for Ontarians.
Lockdowns are being questioned by others too. The Canadian Federation of Independent Business wants them permanently replaced with other measures, citing economic harm. And York Region's Medical Officer of Health is skeptical of their use.
I'm not totally convinced that lockdowns are a good thing.
Dr. Kareem Kurji calls lockdowns a blunt instrument and believes targeted measures are more valuable, saying his comparison of York's data to other jurisdictions has led him to question their effectiveness.
Particularly the time in Toronto and Peel were in lockdown and York Region was not. I didn't see much of a difference between our curves.
McMaster infectious disease Dr. Dominic Mertz says lockdowns effectively reduce virus transmission, but come at a cost.
I think it's really about balancing those pros and cons. So in my mind, they are to be used as a last resort.
McMaster infectious disease Dr. Martha Fulford thinks lockdowns should be targeted to areas experiencing a surge and is very concerned about their impact on children.
We're doing immense harm to them with interrupted education, with social isolation, that this impact is for the entire future of a generation.
Sweet stressed his views aren't the position of his party. Conservative Party leader Aaron O'Toole says frustration with the pandemic should not lead to, quote, counterproductive behavior, and says he respects the work being done by the premiers and health officials. Matt Ingram, CHCH News, Hamilton.